Hello everybody, let us start resuming discussing molecular fundamentals of molecular biology. Today we will make a simple visual map to memorize for anti-cancer drugs or cytotoxic drugs to make it simple even for exams or even for applying knowledge in real life. First of all, we will revise the stages of the cell cycle. As we explained in the previous video, G0 is the resting phase, no growth, the cycle is not, the cell is not replicating. G1 is the preparing for growth. S phase is the DNA synthesis. G2 is the another phase for cell growth. And finally, M phase is for mitosis. There is two checkpoints between G1 and S phase and another checkpoint between G2 and M phase we will discuss in later videos. So subscribe and follow up the channel to review more fundamental videos for molecular biology. So how the anti-cancer drug work? Okay, there is two ways of work. Non-cell cycle specific and specific cell cycle. Non-cell cycle specific simply it's working targeting all the cycle in all phases, non-specifically. The specific cell cycle means that the drug will attack the cell in certain phase. So destroying it in a certain phase most probably will not affect a healthy tissue. So specific cell cycle is better, of course, and with less side effect for the healthy tissue. Anyway, we will memorize the non-specific cell cycle. The most important is the alkylating agent to contain platinum drugs. The idea that they are cross-linking the DNA, so make like DNA paralysis cannot replicate. Also, there is anti-tumor antibiotics in the non-specific cell cycle, but memorize there is pleomycin is an exception. Pleomycin is working on the G2 cycle, and for anthracycline it works non-specific cell cycle as well, except doxorubicin working on topoisomerase 2 inhibitor on phase S. So let us discuss about the specific cell cycle. G0, G1, nothing will happen. For the S phase, we have antimetabolites, topoisomerase 1 inhibitors, topoisomerase 2 inhibitors. As we explained before, topoisomerase 2 inhibitors like doxorubicin, it's anthracyclines, and topoisomerase 1 inhibitor and antimetabolites like methotrexate, 6-mercaptopurine, and so on. For the G2 cycle, there is two drugs, pleomycin, which is anti-tumor antibiotic, but specifically work on G2, and there is trabecitidine, which specifically work in G2. For the mitosis phase or the M phase, we have taxanes and vinca alkaloids. You can request in a comment the question bank for more practicing of this issue, and subscribe in the channel for more explanation and fundamental